This is second day post-op. So I had my CABG surgery 3X, so triple bypass, on Monday, April 28th. Yesterday was my first day post-op. Today is my second day post-op. Earlier this morning, they were able to remove 2 of my chest tubes, and if everything goes well tonight, around 3:30 a.m., they'll remove the rest of it, and that will give me more relief. I don't really know how the anatomy works, but I think it rests underneath your lungs, like 2 of them, and then another 2 kind of sit right on your ribs. I might be saying it wrong. It has been very rough. Yesterday, I could not urinate, and apparently that's something that happens when you're post-op less than 24 hours, and some people have trouble urinating after being under general anesthesia, and those who undergo the catheterization. Yeah, so yesterday my fluids were up to 930 ml when they had to do the straight catheter. And I'm sorry, my cadence in the way that I'm speaking is very short because I can only say a couple of words before I have to take another breath, and it's because of the test tubes. So yeah, that's the progress for today. I'm less swollen. Yesterday I was very, very much swollen. I'm now on Lasix, so what that does is it's a diuretic, and it makes me go, number 1, frequently. And I did a few PT sessions today, and also 1 occupational therapy session. So they showed me some of the movements that I can and cannot do, and we walked a little bit around the hallway. The first one was 150 feet, and then the second one was a little longer than that. So after my second PT session, it was around 2:30, I think, I was able to get a 30-minute nap, and I ended up waking up because I had to cough. I've been really scared to cough, but what I do is I grab my heart pillow, put my arms around it, and try to cough that way. It's still very scary and just has to be done, but it is scary. But when your cough is coming up, it doesn't matter at that point because it's gonna come up with the cough and the phlegm. You just have to spit it out, and it's good when you're coughing and you have that phlegm coming out because you don't want that sitting in your lungs. You don't want to get pneumonia. So, and this is my scar. This one was removed last night, and I also have a radial artery extraction, and that's the artery that they used for my triple bypass, along with the mammary gland one, or the mammary artery one. Oh, also, this is the linos I told you yesterday. This is what's it called? The jugular vein. So they had 1 line here during the surgery, and that allowed them to put any medication as needed, I believe, or blood tests as needed. And I also had like some other lines. I still have this one. This one I had done when I was in the ICU, and it's the last one that I have. And I have tiny veins, so let me show you. If you can see there, I've had a few blown veins. This is my room. Yeah, everything's going well. I'll give an update on day 3, hopefully. Day 3 post-op. which is tomorrow, the 1st of May, Thursday. Hopefully, I will no longer have the chest tubes, and that will allow me to no longer need assistance when going to the restroom. And I would love that so much because it's been a hassle having to call every time, and everyone's been amazing. But I just personally, I don't like having to rely on someone else so that I can do stuff on my own. So that'll be great.